talk about the eye and age-related diseases. Today I would like to talk about structures and anatomy of the eye, as well as discuss a few common diseases associated with our aging process and how we treat them. The eye is made up of three layers: the fibrous layer, the vascular, and the neural layers. These layers are what perform diverse functions which make the eyeball work, like transcending light into action potential, and of course maintaining the shape of the eye. The fibrous layer is the outermost layer of the eye and consists of two parts, the cornea and the sclera. The sclera is the white part of the eye which is white due to its abundant collagen fibers. It is also these fibers that help it be resistant to deformation or from internal or external forces. The next part of the fibrous layer is the cornea. The cornea, which is the extension of the sclera into a translucent covering over the anterior chamber and the pupil. The cornea's main function is to allow light into the eye and to focus it. This is also where the contact lens sits, and which also can allow oxygen to reach the cornea and prevent eye irritation. The vascular layer is the next layer of the eye, which has three parts and is located directly behind the fibrous layer. The choroid layer is the most vascular layer of the eye. It also contains melanocytes, which produce pigments that are designed to reduce the scattering of light into the eyeball. Therefore, some pictures will contain the red eye effect, which is due to high vasculature and blood within the choroid. The choroid continues to the front of the eye to the ciliary body, which contains smooth muscle and surrounds the lens that are also connected to fine threads called suspensory ligaments. Right here. These function to relax and contract the smooth muscle to change the shape of the lens, which then focuses light into the retina. The iris is an extension of the vascular layer, which lies right in front of the ciliary body. The iris is the visibly colored or pigmented part of the eye that surrounds the opening in the middle called the pupil, which is the opening of the eye that lets the light enter. The iris can dilate and contract to control the amount of light entering the eye, which is an immediate reaction to stimulation from our parasympathetic nervous system. These autonomic eye openings are controlled by the pupillary dilator muscles and the pupillary sphincter muscles. The retina is the deepest layer of the eyeball, which consists of two layers. The first layer, which lies directly behind the choroid, decreases the scattering of light and is made up of pigmented epithelium, the fundus area down here. And the deep part of the retinals, which is made up of rods and cones, is also known as photoreceptor cells. Towards the back and center of the retina lies the macula luda, and directly in the center of that is the fovea centralis. This high concentration of photoreceptor cells is where we can see things in great detail and focus on a particular object. The macula is also named for the term macular degeneration, in which age-related types seem to be occurring at a great rate within the United States. The lens of the eye is located directly behind the iris and focuses light on the retina from objects close to the eye. When these lenses become opaque or cloudy, they're called cataracts. The optic disc is where the axons of the nerves gather together. This is also where our blind spot is due because there's no photoreceptors. Inside the eye is the vitreous humor, and it is a gelatinous material mostly made up of water and helps maintain the shape of the eyeball. The three most common age-related eye diseases that I'm going to talk about are macular degeneration, glaucoma, and cataracts. Age-related macular degeneration is the primary cause of vision loss in older adults, with approximately 11 million people in the United States having some form of the disease. Age-related macular degeneration, I'm going to call it AMD, is classified as a wet or dry. Dry AMG is the more common form, which accounts for almost 90% of the cases. With dry AMG, the more common form, which accounts, with dry AMG is the more common, which accounts for almost 90% of the cases. With dry AMG, the macular cells of the eyes begin to deteriorate or waste away. This leads to a central vision loss that is gradual in onset. Dry AMD can affect the retina with an accumulation of extracellular deposits known as drusen, and over time this drusen will cause the macular cells of the retinal lining to waste away or atrophy. With wet AMD, there are abnormal blood vessels called vascular endothelial growths, which will grow into that retinal epithelium, and there they will start to bleed and leak. And once that happens, they will form scar tissue, and it has a picture of damaged macula, and then how the blood vessels continue to grow in this area right here. Age-related macular degeneration usually affects the eye's ability to focus on fine detail like reading, driving, and seeing people's faces. They may have a distorted, darkened, or blurred vision, as well as blind spots that block your vision. Diagnostic tests include an ophthalmoscopy that investigates the fundus of the eye, which is the back of the eye, and can determine the retinal lining and any abnormalities within the lining. To determine the type and extent of the age-related macular degeneration, an IV contrast angiography and fundus imagery are done to verify this type. It is a special IV contrast that they use just for the eyes. Treatment for dry age-related macular degeneration is yet to be found, but with wet age-related macular degeneration, there are a couple of options. Some people may choose to get injections into the vitreous cavity, which slows the microvessel's growth. Another treatment is the use of photodynamic therapy, which can damage the new growth microvessels with a combination of specific IV contrast called Visitin and a cold laser to stimulate the dye. It is imperative for the patient to avoid sunlight or even a halogen bulb to prevent any possible reactivation of this Visitin dye, this contrast dye, and it could damage the eye if that happens. It's imperative that the patient includes a healthy diet and lifestyle, which can help prevent this disease. Otherwise, smoking, diabetes, and hypertension can also be linked. The next age-related disease that I'd like to talk about is glaucoma. Glaucoma is more prevalent in people over 40 and is the third most common age-related eye disease in the United States. Glaucoma refers to a group of ocular disorders where the optic nerve becomes damaged. The most common type is a primary open-angle glaucoma and angle closure glaucoma. As you can see, there's normal no tension, there's acute angle, there's chronic angle, secondary, and congenital as well. This ocular disease is due to a buildup of aqueous humor, which cannot flow properly from the anterior chamber. As you can see, there's pressure, it builds up and it puts pressure on the optic nerve right there. Causing intraocular pressure and puts pressure on the optic nerve, and it kills the nerve. Let's see. Glaucoma has been referred to as the silent thief of the night because most individuals do not realize they have this disease until their vision has decreased dramatically, causing tunnel vision. This allows for only a small central area of sight, and all peripheral vision is lost. Acute angle glaucoma may cause sudden eye pain with nausea and vomiting, along with colored halos around lights, ocular redness, and blurred vision. Diagnosing glaucoma involves the use of a tonometry device to measure the intraocular pressure, having an ophthalmoscopy done to inspect the optic nerve, along with a central and peripheral visual field test. The treatment for glaucoma is to maintain normal intraocular pressure and to prevent optic nerve damage. There are many pharmacological treatments, including miotics, which are cholinergics that constrict the pupils. There's beta blockers, adrenergic agents, prostaglandins, and carbonic anhydrase inhibitors. Surgical treatments include laser trabeculoscopy, which helps promote the flow of aqueous humor. There's peripheral laser iridotomy to relieve pupillary blockage, and filtering procedures like the trabeculoscopy, which facilitates exit point for the aqueous humor. So what they're talking about is putting little channels and paths so this can flow and not put pressure there. And it shows right here how they do it. Oh, excuse me. Okay. Managing glaucoma requires the individual to maintain a strict adherence to their medication regimen. They need to understand how these medications can cause blurred or altered vision. They need to understand what the side effects are and any medication interactions that could happen. It is also advised that they keep a record of their intraocular pressure measurements, visual and field test results, and always keep and follow up appointments for your doctor so they can measure your intraocular pressure. Lastly, I would like to talk about the leading cause of blindness in the world, cataracts. A cataract is when the lens of the eye has cloudiness or opacity. Although age-related or senile, it's also called senile cataracts, are most common, there are many contributing and risk factors associated with the formation of cataracts. Some of these are UV sunlight, trauma, smoking, eye inflammation, diabetes, poor nutrition, and certain medications like long-term corticosteroid use. The decrease in vision is gradual, and symptoms may include a glare from the light that scatters through the opaque lens, impaired color perception, perceiving that the surroundings are dimmer than what they really are, and reduced visual acuity. Diagnostic tests include the Snellen Visual Acuity Test, an ophthalmoscopy, and a slit lamp biomicroscopic examination, which are all used to diagnose the level of cataract formation. Treatments for cataract should start with educating your patient on the disease process, so the patient can opt for the non-surgical management if they feel so, or which is obviously going to be a stronger set of glasses, lifestyle modifications, include better lighting in your house, and if they're hesitant on surgical treatments, this might be the way to go. When the disease process overruns your lifestyle changes, then the surgical removal of the lens is the next step. This surgery is called phacoemulsification and are commonly used to extract the lens, cortex, and nucleus. Other surgeries include the extracapular cataract extraction and intraocular lens replacement. It is important for the nurse to assess the readiness of the patient, do a routine physical examination, and the client's medical history. It is also important to ask the client if they are taking any alpha antagonists like Flomax or tamoxifen, which can interfere with the pupil dilation during surgery. Patient education is crucial for post-op cataract surgery due to the various medications, their side effects, and post-surgical requirements, like wearing a protective eye patch and sunglasses while outdoors. The nurse would advise the patient to notify the physician if they see any floaters or dots in their vision, a decrease in vision, flashing lights, pain, redness, or if the amount of drainage in their eye changes. Instruct the patient to avoid laying on the affected eye the night after surgery. After surgery, the eye patch should remain on the eye until the first follow-up visit, which is usually around 48 hours. During that time, you need to be extra careful not to fall or get injured from the visual impairment and lack of depth perception from wearing the eye patch. Lastly, they will also need to be made aware of their new vision baseline, because you could have some contrast sensitivity and increased night glares as well. Thank you very much. That was my presentation on the eye and 3 age-related eye diseases. Thank you, ma'am.